is Letizia Hendrickson, and I've been a practicing speech-language pathologist in the greater Los Angeles area since 2009. I've enjoyed working with individuals across the lifespan in schools, in home, in early intervention, adult acute rehab, outpatient, and in private practice settings. I specialize in assessment of communication disorders, clinical education, and ADHD. And as we dive into the role of supporting individuals with ADHD, my hope is that we will be able to, by the end, identify the communication and executive function challenges commonly associated with ADHD, which many of you will know, and then explain how speech therapy addresses social communication, language processing, executive function, literacy skills, self-awareness, speech production, and voice disorders in individuals with ADHD. It's a lot, and I don't think that people are really aware of all the things that we address. And then we would like to describe evidence-based speech therapy approaches and strategies that support communication and executive function in individuals with ADHD. And last but not least, recognize the importance of interdisciplinary collaboration in ADHD management and how speech-language pathologists and speech-language pathology assistants contribute to family-centered care. So I have a lot on this slide already. We're going to jump in. I promise it won't be all chock full of information, but ADHD is a complicated issue. And we need to look at the underlying pieces that are part of it. So the DSM-5 uses the neurodevelopmental model that ADHD is a neurodevelopmental condition characterized by inattention, hyperactivity, and impulsivity, and that they interfere with functioning or development. And these are observable behaviors, right? They don't tell us a lot about what is going on internally with that person. But I do want to note here that ADHD can also be acquired via traumatic brain injury, and that may also account for some of our adult populations or our children who have had concussions. So let's talk a little bit about executive function. Cognition is an umbrella term for cognitive processes such as attention, memory, problem solving, and executive functioning. Executive function is associated with the frontal lobe, which is right behind your forehead. You can see how a blow to the head with a swing, or during football, or by a moving vehicle like a car, bike, or scooter, you could impact the frontal lobe. But even a blow to the back of the head can result in concussion with coup contra coup injury, where the brain strikes the opposite side from the impact and then swells. Wear your helmets. So with executive function, there's a relationship with communication, because here we house in the prefrontal cortex areas such as attention, memory, working memory, which helps you remember what's being said, and inhibiting impulses, not blurting out what you want to say, acting as the brain's executive function center. It's the system that takes all the information and figures out what to do with it. And this is impacted in ADHD. So we use these executive function pieces for language processing and even social communication, literacy, and speaking. So here I wanted to point out this picture on the bottom left. I know you can't read the little things, and I don't want you to worry about it. What I want to illustrate here is these colored pieces, like the frontal lobe right here, the prefrontal cortex, or even the cerebellum, and all these other areas that have little highlights on them. But the important part are those little arrows, because those are the indicators that all these systems are connected. So then when we look at speech and language, how does speech and language processing work? Like many things in our brain, language processing involves a complex network of regions, primarily in the left hemisphere, which is key with speaking, as an area of Broca's, which is here on the left-hand side, kind of down here, and Wernicke's, which is here, which is for comprehension, and other regions like temporal and parietal lobes, which play a crucial role in communication. Children will use both hemispheres when they're developing, and then language centers refine in the left hemisphere, although bilingual speakers and women sometimes also have language pathways in their right hemisphere, and males as well, but typically it will specialize and develop in the left side with dominance. Now, you can see here that some regions highlighted for specific processes like semantics and phonology, they overlap with these areas impacted by ADHD. So the takeaway here is that ADHD and communication are things that need to be worked on together because they do overlap. And these vital processing areas for receptive language, expressive language, motor speech, fluency, which is stuttering, reading, writing, and pragmatic social language can be impacted. There are some numbers out there that approximately 70% of children with ADHD will need a speech pathologist at one point in their life, but I haven't found a great number on that in the research, but I'll just throw that out there as more of an anecdotal piece. What are the communication challenges that are there for individuals with ADHD? And again, this is not uniform. ADHD is much like autism. It is a spectrum of how much it is impacting your life. But in general, the difficulties related to communication stem from the impaired cognitive processes of language processing, attention, memory, and executive function, with mitigation by impulse control difficulties. So the areas that we're looking at here are going to be comprehension, understanding verbal information, instructions, narratives, multi-step tasks, abstract language. You tell someone, okay, first I need you to go to the store and pick up some butter, but on your way back, can you also drop by the cleaners and pick up my items, or things like that that require sequencing that is given verbally. And then expression is generating typically age-appropriate cohesive sentences. And I say typically age-appropriate because we do know, as Dr. Barkley has pointed out to us, that with development and ADHD, there is approximately a 30% delay in brain development, so that age appropriateness becomes a little more blurred when we're working with our ADHD population. So with expression, we want the sentences to be cohesive, and that requires thought organization, sequencing, prioritizing of ideas, grammatical markers, and things like presupposition, which is giving background information. If I have a thought in my head and I have all this information that relates to it, but I don't convey that, you may be lost in that conversation. And then also speech rate regulation. As you can see, I'm a fast talker, and some people with ADHD speak even faster because their thoughts are so rapid, and we'll go over that a little bit more as well. Then we have pragmatic language and social language aspects. I do separate social skills from pragmatic language because language is what you use in social skills areas, right? So we want to make sure the language is there, and then can we apply those language skills in social situations? And these can be reading nonverbal communication, like attending to body language, people's tone, reading communicative intent, allowing for conversational turns, asking questions about others' interests, inhibiting behavior in speech-based or environmental cues, right? If we're in a doctor's office, what is everybody else doing, and what is my body doing, and what is my brain doing, and what am I saying or not saying? Then we have the area of fluency and stuttering, and this would be disfluent speech. So many of you know what stuttering is, but there's also a term called cluttering, which is a rapid rate of speech using filler words or having difficulty finding a word. You might get stuck on it. And then we also have voice. Now, many people don't think about voice as an area of impact for ADHD, but vocal abuse and dysfunction is more likely to occur with children with ADHD. So this would be due to maybe screaming, loud speech, or too much quiet speech. Even whispering is not that great for your voice over long term. It can result in hoarseness, laryngitis, vocal nodules. And then we have literacy, which is going to be reading comprehension and writing and composition. We know also that ADHD is co-occurring with dyslexia often, and attending to written sources, remembering sentences that you've read or read over and over again, organizing the information and retaining that information memory, right? Generating written content, organizing your thoughts, monitoring for your grammar, your vocabulary, word recall. You can see how all these processes that tie together can greatly impact your communication. And then we can throw in their prosody, which is going to be that use of tone to convey meaning. So if we're speaking really fast, our tone tends to suffer a little bit because it takes an additional moment of control to raise our pitch. And with the rapid rate, that is decreased, or if we're not monitoring, we also might sound monotone. And then memory, right? Remembering information. You have to attend to that information. And you also have to have good processing rates for that information. And we know that with ADHD and autism as well, processing rates can be impaired. And attention, of course, that's one of the hallmarks there. And that attention kind of goes into time management, processing of information in school-based or work-based project management. So our role, as you can see, as a speech language pathologist includes a lot of these domains. It is in our scope of practice, and it aligns with areas impacted by ADHD. We play a crucial role in supporting individuals with ADHD by addressing the various communication and executive function areas. I would also like to note here that speech language pathology assistants are also qualified to work in these areas. The primary difference between a speech language pathologist and a speech language pathologist assistant, or SLP, SLPA, or sometimes a SLPA, is that the assessment is conducted by the speech pathologist along with the treatment plan, after which either the SLP or the SLPA can execute the plan of care. And so while looking at that scope of practice created by the American Speech and Hearing Association, we can treat the areas of cognition, speech production, fluency of voice, auditory habilitation, and rehabilitation. While primarily it is for individuals who are deaf or hard of hearing, who may have had a cochlear implant, or their other hearing issues that we are addressing, auditory processing is also within that domain, which tends to be impacted with our ADHD population for those who have more receptive or working memory issues. And then language encompasses a lot of things. It's spoken, written, listening, speaking, reading, writing. And then there's phonology, which is understanding phones or sounds. Speech, right? We understand that a K is a K. And for children who may have difficulty with those processes, they may have phonological processes that have stayed on past their age range where we would expect that to fade, and that can impact spelling and reading down the line. So then where do we work? As you can see, there are a variety of settings, each with a different approach to intervention. With early intervention, we're working with children typically under 3 in a one-on-one in-home or sometimes a clinical setting, and they might be in an individual or group-based if it's more social skills. We tend to look at risk for delays, like history of prematurity or family history of communication delays, or if there are other disorders present and the delays are more evident. In schools, if it's either a push-in model, like in preschools, or they're going to be a pull-up model. And the attention here for schools is access to the core curriculum, where we're looking to see if the children are able to access what the teacher is doing, right? And if we have ADHD, oftentimes the children are perceived as disruptive because the behaviors are seen as something that they do versus seeing the underlying areas of deficit that may need a team approach to help them attend to that curriculum. In a medical setting, this is for medically necessitated speech therapy, typically what school-based intervention does not access or address rather. And it is typically episodic care, meaning there's a beginning and an end time. So it's not meant to be ongoing for long periods. And in private practice settings, there's a little bit more flexibility in addressing specific areas of deficit, continuing that early intervention that has stopped, or other areas that school or medical setting may not cover. So then language processing and executive function. We have seen how integrated languages with executive function, deficits such as challenges with planning, organizing your thoughts, managing impulsivity, sequencing tasks, and maintaining attention translate to difficulties in starting or completing assignments, creating cohesive bodies of written work, difficulties staying on task, and those are all common with individuals with ADHD. SLPs can implement interventions targeting these skills, which are integral to effective communication and daily functioning. The role of the SLP can include providing interventions that address these executive function deficits, particularly in children with co-occurring developmental language disorders and executive function deficits. And then social communication challenges. This tends to be something that gets noticed more. And we have to make sure that the pragmatic language aspect is the underlier that may also contribute to the social communication challenges. These can be, how do you initiate a conversation? How do you take turns? As adults, we may take a turn in a conversation by nodding to acknowledge the individual, but that does entail that we have to attend to that speaker, and that can be challenging for ADHD individuals. And then maintaining that topic of focus, right? That is definitely an area that can be so hard. We have so many thoughts and so many interesting things we want to talk about. And our association pathways, meaning the thoughts that trigger another thought, those are much more available to ADHD individuals. So we get off topic sometimes. And then responding appropriately in social contexts. I do have a little bit of problem with that word appropriately, because who's defining that appropriateness and how we're expecting our individuals to respond, that can be a little bit of a point of contention. And we want to make sure that we're arming our students with ways to advocate for themselves as well, not to be always passive or take the high road. And then, the systematic review of children with ADHD highlights that there are higher rates of pragmatic difficulties compared to their typically developing peers, particularly in areas such as inappropriate initiation of communication or activities and narrative coherence. Those are difficult. So we as speech therapists provide support in this area, especially in the pragmatic language, but also in social skills groups where we practice these skills. So you can see here on the left, right, the language tasks are kind of highlighted, and then the social talk, they're overlapping. They require that foundational skills, and they overlap. And we want to make sure that we're addressing these things to provide more ease with communication and in social contexts. So children with ADHD may also experience difficulties with reading comprehension, writing organization, and spelling. And I keep bringing back these brain images because we can see that the areas impacted with ADHD correlate with some of these areas that are used for processing written and reading information, writing and reading. So there may be literacy challenges, the difficulty understanding and retaining the text, and struggling with inferencing and main ideas. It requires more abstract level thinking. We have over here in this area called Geschwind's area, which is that integration of comprehension and expression and what we know about those things and putting them together, like idioms. She's the apple of my eye, or things that require a little more abstraction, like how do you define freedom? And then the other half is going to be that writing organization, being able to cohesively put together your ideas, structure it, sequence it, where it reads with making a point. Revisions, 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 right? Those can be very frustrating for individuals with ADHD who kind of want to get that task done and just go. So with speech therapy, we support decoding comprehension and writing skills. And the literacy challenges, that is an area that should be addressed in school, but because of the nature of group therapy or perhaps that individualized need, it may not be enough to just do it in school. You may need to do therapy outside of that. And some of these areas are so intensive that it gets our kids very tired. They're trying so hard. And this is a functional MRI that shows you how much areas can light up. This is during brainstorming where you can see that expression and comprehension areas light up and a little bit of the motor strip. And that's because when we're thinking, our fine motor strip is actually activated to speak. But as we get older, we suppress the actual movement and it's just in our head. It's initiated still. And then when we're actually doing the creative writing, that fine motor task comes in, which is your fingers, and these more higher level areas get highlighted here, indicating that this abstraction and organization is occurring in these pathways that are required to create these bodies of work. So then speech production and fluency, right? This is kind of what we're known for. We're known for articulation. How do you say it? Your R's, your L's, your TH's, or if you're stuttering. And while this may also be present developmentally with our children, cluttering tends to be this unique area that is more highly associated with ADHD due to difficulties inhibiting output. And they're pressed for speech. We want to talk. We have a lot to say. And we have disorganized thoughts and decreased pragmatic awareness and decreased self-monitoring and just sometimes wanting to get your thought out for fear of forgetting it. So what we see with stuttering is that we have the right hemisphere and the left hemisphere, which help regulate the flow of speech. And the right hemisphere, the right here on this side here, we have that inhibition. That's the stop. And the left is the go. And what we see here is that there are overactive and tightened connections in the frontal ascendant tract right here, which is FAT is a short word you don't need to remember. And that sign of strengthened movement inhibition is decreased with people who stutter, and it interrupts the flow of speech and might inhibit the activity in the left. So we address cluttering and stuttering with fluency shaping techniques, and these might be providing them with pacing techniques, providing the breath at the right time, so they're not speaking on residual air where they're trying to get everything out, and you go into a glottal fry and you just keep talking, and your voice gets smaller. And noticing these things occurring, right? Bringing the brain's attention to it. And then there might be a component of communication anxiety. We do know that anxiety can be a co-occurring issue with ADHD. And if that's happening, that may contribute to fluency issues. And we want to address those. And speech therapy for fluency does address feelings about stuttering or cluttering to help recognize what is the underlying driver for these processes and then shape those and give a better understanding and control over these fluency events. So then voice disorders and ADHD. Children with ADHD might be at higher risk for voice disorders due to executive function difficulties. It's kind of wild to think that those go together. How are they connected? And it's a difficulty inhibiting impulses, such as blurting things out at a loud volume in order to be heard, or just not modulating your volume at all, or you're very active and you're doing things and you're trying to get your voice heard over larger distances, which require a lot of air volume, and hard glottal attacks, which is using your voice with a lot of air suddenly, creating that contact that can rub the vocal folds. And screaming due to emotional dysregulation. We do know that the limbic system dysregulation is much more impacted with ADHD. So we have more emotional meltdowns. And then speaking for long periods with incorrect diaphragmatic or breath support due to rush speech or using residual air. Or sometimes we have the ACEs, which would be the adverse childhood events, PTSD, things that co-occur with ADHD that can create this trauma response breathing that's up high, it's in your chest, you're taking small, shallow breaths, and you're still trying to convey your thoughts very quickly. These things can create tension in the neck and the small muscles and create dysfunctional use of the voice. So in speech therapy for voice, we discuss vocal hygiene, which is not brushing your vocal folds. It's about what are some things that you can incorporate into your life for optimal voice function, so your voice is the best. And we help with these strategies to prevent long-term voice issues. Now, I went over one study by Luz and Secundino, I believe, and they showed that when they were taking aerodynamic analysis, so they're measuring the flow of air in subglottal pressure, which is the pressure that goes from your lungs into your voice box here, that it's higher for children with ADHD, but that the actual airflow in the vocal fold area is lower when you compare that to children in their control group. And then they did a visualization of the vocal folds, and it showed vocal nodules in approximately 78% of the children with ADHD and hyperfunctional vocal behavior in all the children that they studied. It's a smaller study, but these are indicators that we need to pay attention to our children's voices and even adults, right? We talk a lot. I talk a lot. There's a little glottal fry right now in my voice as well. I'm going to need to utilize some vocal hygiene strategies to give myself some voice rest. And then the one thing I want to touch on right there, it says throat clearing, and sometimes repetitive behaviors that feel good, or if we have allergies, we might be clearing our throats often, or if we have OCD or Tourette's that create vocal tics or vocal clearing, those can also contribute to vocal cord inflammation and dysfunction over time. So we might be the first ones to see those issues because they're referred for voice rather than being referred to psych for looking at these areas. So then we as speech pathologists tried to provide evidence-based interventions for these areas. We do interactive activities that engage attention and promote learning. Contextual-based approaches is our jam. We want to do it in context because we know that people learn better when they get to actually do the thing and practice the new skill in the action they're going to do it in later. And oftentimes it may not be the what, as in what they need to do, but how do you do it? And with speech therapy, we definitely cover the hows in addition to the whats. And we also try to provide multimodal access to learning, like visual supports, auditory cues, motor activities, all of which can engage people with ADHD more than traditional learning-based activities. Now, this, of course, needs to be balanced with the individual's sensory tolerance or their sensory seeking or regulation needs. And these are all considered when we're providing therapeutic intervention. And then additionally, the direct instruction targets self-regulation, organization, and communication skills. And last, we try to build that self-awareness regarding personal communication strengths and weaknesses to enable individuals with ADHD to better manage their communication challenges. So these are perhaps surprising, but hopefully not very new to everyone. And then the piece that I love the most is the collaboration with families and educators. We work closely with teachers, parents, psychologists, occupational therapists, physical therapists, adaptive PE, and other professionals involved in the care and support of an individual. This is also very much true for individuals with ADHD. And this is partly to also help generalize skills outside of that treatment space. We collaborate, find out what people are working on, or we share what we're working on and have those skills practiced in a variety of settings. And then we'll provide strategies for integrating speech therapy goals into home or classroom settings or with adults into the workspace. So the collaboration really enhances the effectiveness of interventions and promotes the generalization of skills. Now, the importance of early intervention. Brain development is very rapid early on. And if ADHD is a hereditary neurodevelopmental disorder, then our intervention can help that brain grow in directions that are going to be more serving to the individual. Early identification and intervention improve outcomes and provide strategies that can be used across the lifespan. If family history is present for ADHD, early support can benefit the entire household. Dysregulated children and dysregulated adults are not a great formula for morning routines or other times when we really need to have some strategies in place. And so the whole family can benefit from speech pathologists' work and strategies and home plans and other programs that we can provide. And the plans for therapy should always be individualized. We don't do cookie cutter treatment. They're based on strengths and the needs of the whole family. So some case study examples. So I wanted to kind of give you an idea of what speech therapy may look like for different stages in life. We talked a little bit about that early intervention for the little ones, and that's going to be where they're going to be at. So that might be the playground, it might be during meals, and other times like circle time, singing songs, or child-directed play where we're providing this intervention. For the elementary student, this is going to be primarily in the school setting. So we would address things like organization, how do you create that body of work that the teachers are asking. So we might ask for work samples, look at where the breakdowns occur. So if they have to write a two-word sentence, a two-sentence paragraph about fall, and we're looking at that work, are they using colorful language? Are they providing that information that is being asked of them? And then providing a strategy to how to do that. So we might tell them, okay, this is your sheet. The teacher told you what to do. You don't know what to do. What can you do? And then there are the strategies, learning how to ask for a repetition or figuring out ways to get that information to help you start your project. And then outlining for yourself in your mind, how are you going to organize this? And sometimes children will provide the bare necessary information, and that's okay. But figuring out ways, is that going to be because there's a lack of vocabulary underlying issues, so they don't have enough verbs or adjectives to create a really nice sentence structure? Or is it because they're just rushing through that activity because they're not motivated and they don't see the benefit in completing that? We may implement reward mechanisms in the classroom or with the parent that the child can earn through these bodies of work. So they provide those external motivators as they're developing their internal motivators. For adolescents, there we might have some more academic organizational issues, providing strategies for how to deal with having difficulty reading. So I might have them block text if they lose their line while they're reading. I might have them create little summaries in pieces instead of trying to do the all or nothing approach of the reading the whole chapter and then going back and tediously figuring out what they just read, or taking breaks, or acquiring that information in other ways, if there's maybe an auditory recording of that, if that's what they need. And then the same kind of things for how to break down projects into smaller pieces, and then being able to start little bits of it when they have the time or the mental space for it, and then putting that together slowly instead of like that sit down, do it all at once right before it's due. And then for adults, these strategies are scaffolded into the strategies that may be compensatory. If you have time blindness like me, using timers and other strategies like several places, having the reminders for yourself. It might be a calendar that's digital. You might be using motor tasks to write down that task into a planner, or having a phone that connects to your watch that kind of vibrates, lets you know where you're at. And then other areas that may be difficult are addressed in these kind of ways. So there are cognitive work that we do with individuals, especially if there has been some sort of insult, that are more medical based. So this could be aphasia, which is difficulty with word recall, which sometimes is present with ADHD as well. Creating strategies on how to find that word. We have things like VNest or semantic feature analysis, which are fancy words for tell me everything you know about this thing you're trying to name, and then see if that helps kick in that object. For those of you who are involved in the care of an individual with ADHD, I hope you can now see why an early referral for screening for a speech language pathologist can be an invaluable tool in your toolbox. For parents watching today, I hope that this presentation sheds some light as to why seemingly unrelated areas demonstrate with difficulty for you or your children with ADHD. While not all speech therapists are necessarily aware of their crucial role with ADHD, they are highly trained in the areas that are needed for communication and cognition. And they may be working on that without a formal diagnosis for ADHD.